but I will tell you that actually finding fatty liver, so you guys follow this so far, it's a huge problem. There's more glucose dysregulation than we probably realize because of reference rate, because of the healthy population. One of the manifestations of that is fatty liver. And it is really hard to diagnose. Number one, I'm going to jam through some of this. Liver biopsies aren't accurate. It only looks at 1/50,000th of the entire liver, and it grows in patches. And this fibrosis staging, it can show up differently, and even pathologists disagree on the staging of it. Okay. Also, ALT, I can just multiple papers. ALT is normal in people with fatty liver. Diagnosed fatty liver in studies have a normal ALT, usually somewhere in the low 20s. Okay. Now, all these papers say the same thing. Only 55% with fatty liver had high ALT, and that's above 40 or 50 in some cases. Okay. Same thing in this paper. The entire histological spectrum can be seen with normal ALT values. ALT doesn't help differentiate any of these people, and it doesn't. If you have low, doesn't mean that you don't have steatohepatitis. Here's a couple optimal ranges that I have found in the literature, and if I'll just give you a little tip. If ALT is ever a little higher than AST, that's in most cases all you really need. Okay, that is a big tip off. ALT is a little bit higher than AST and above this. So you can have a woman that has an ALT of 25, and if her AST is 20, I would suspect fatty liver until proven otherwise. Okay, number 3, then you have ultrasounds and CT, but that doesn't catch early mild fatty liver. This is a big one. And again, this is recorded, so I'll just kind of flash this on the screen. You can pause this later. Non-alcoholic fatty liver disease happens in lean people as well. And what this next one says is they have a more severe histological presentation and higher mortality. So we might look at somebody and say, well, you're not a candidate for fatty liver, but in fact that they might actually be. And then this one here is, if you drink a lot of alcohol, guess how long it takes in order to get fatty liver? About 10 years. And the worst part is this process is silent and symptom-free, except for things like anxiety and depression and cognitive decline. Some of these things that we don't usually think of. So for all those reasons, this paper said it ranks the most serious public health problems of our time. Finally, somebody. But it's really, really difficult to diagnose. So a lot of people have it. It's associated with a whole bunch of things, which are not making people think of the liver. Detecting it is really difficult. And so therefore, I think we need to pay more attention to it.